Hello, everyone, and welcome back to AHTV, Aortic Hope's YouTube channel. If you're new here, welcome. And for those that have joined us before, thank you for coming back. I'm Molly Thomas, and this is your Aortic Hope Week in Review, where we take a moment to reflect and reconnect and highlight things that we shared this past week within our community. This channel exists for one reason, and that is to create connection and to share education and to offer hope for patients, caregivers, survivors, and anyone touched with aortic disease. So this week we kicked it off with Movement for Movement Monday, and this is about not this is a great article because it gets you moving, it gets you motivated, but also it tells you that you listen to yourself and yourself only. You know what your body needs and what its limits are, and it's not a competition with anyone, just as long as you move. So some ideas for what that movement looks like. You can take a 5 to 10 minute walk inside or outside. I guess inside it would kind of depend on how big your house is, but you can go from one end to the other. Gentle neck, shoulder, and ankle circles, stretching, whether you're seated, laying down, or standing up. Deep breathing, light housework, chair yoga, wall stretches, listening to music, dancing, which also elevates your mood too, and rest. We know that doing nothing is also doing something. So listen to your body. If you need rest, that's perfectly fine too. Every kind of movement counts. And as we move on to Topic Tuesday, this is contributed by Ani, one of our medical students, and we're so grateful for our medical students for contributing all this great medical information, generally surrounding aortic dissections, aortic aneurysms, aortic disease in general, and all things aortic. And they really bring it. They bring it. So today's Topic Tuesday, or last week's Topic Tuesday, is about aortic dissection. And an aortic dissection is a serious and scary diagnosis to hear. The name alone can sound overwhelming, and the details are often explained quickly during a very stressful time. One of the first things doctors talk about is whether or not the dissection is a type A or a type B. And while they may sound like medical shorthand, the difference is pretty simple, but very important. So what is an aortic dissection? So the aorta is the largest artery in the body, and it carries blood from your heart to the rest of your body. The wall has several layers, and an aortic dissection happens when a tear forms in the inner layer, allowing blood to flow between the layers and split them apart. And this can weaken the aorta and interfere with blood flow to vital organs. A type A dissection involves the ascending aorta, the top part, and it affects part of the aorta closest to the heart, the ascending aorta, and may also extend into the arch and beyond. So why is it so dangerous? Well, this area is under very high pressure, and because it's closest to the heart and the aortic valve, it makes it more prone to rupture or have serious complications. The typical treatment for a type A dissection almost always requires emergency surgery. And the goal of this surgery is to remove the torn section of the aorta and prevent rupture and restore normal blood flow. Because of the risks involved, type A dissections are treated as life-threatening emergencies. So then what is a type B dissection? Well, it starts further down. It begins in the descending aorta, farther away from the heart. And why is it so different? Well, because the pressure is lower down there, and the complications often develop more slowly. Typical treatment, they can be treated without surgery, mostly, using medications to control blood pressure and heart rate. And when would surgery be needed in a type B dissection? Well, if there are complications such as poor blood flow to the organs, ongoing pain, or a rapidly enlarged aorta. So here we have several diagrams. Here we have several diagrams of what a type A and a type B dissection look like. So to the left here is a normal aorta. And here we have the type A or type 1 and 2, which starts in the ascending area of the aorta. And here to the far right is a type B dissection, which includes the descending aorta. So the type A versus type B label helps doctors decide how urgently treatment is needed and what kind of treatment is safest. It's not a measure of how bad the dissection is, it's just a guide to choosing the right approach at the right time. So what does life after dissection look like? Many people live full and active lives after an aortic dissection. Long-term care usually includes strict blood pressure control, regular imaging, and ongoing follow-up with both heart and vascular specialists. Early diagnosis and proper management make a huge difference in the outcomes. The bottom line, Ani says, a type A and B dissection are both serious, but they're treated very differently. The type A usually requires emergency surgery, while the type B is often managed with careful medical therapy. Understanding the difference can help patients and families feel more informed and empowered during a very stressful time. And he has included some great resources. So if you want to take a deeper dive into this topic, check out Ani's post on our website and the references he left there for us. All right, so moving on, January 23rd, 123, January 23rd, 123 is Caregiver Appreciation Day. Why 123? Because caregivers make giving care look as easy as 123, and we appreciate so much all of our caregivers. They could be a family member, a neighbor, a friend, even a medical professional who dedicates their time and energy and hearts for caring for others. You know, their work is invaluable, and yet to the patient, yet they feel sometimes very isolated, overwhelmed, underappreciated. Many struggle to find time for themselves and feel guilty asking for help. They face challenges such as stress, burnout, anxiety, even depression. We love our caregivers and we need to care for them and reach out and thank your caregiver today and any day, every day, every day. Every day is Caregiver Day. We need to appreciate and should always appreciate our caregivers. All right, continuing on, we have on Saturday, we did our Replay Saturday Survivor Series, and this one features Derek Reed. And if you have yet to check out our Survivor Series stories on our YouTube channel, please do so. There are so many. I think we have like over 175 or even more. And they're all great stories. They all, you know, can touch people in different ways, all different stories. They're incredible. And we thank everyone who has contributed. And we look forward to some new stories that you would like to share with the community. And just click on that little link and sign up, and we'll be in touch with you real soon. You can do just a written story, and we'll put up your written story with a photo. We could record. We have lots of options to share your story. So if you haven't done so, please do so today. It's incredible effect it has on the community. And Sunday is where we share with you some of our great resources here at Aortic Hope. And it can be found under the resource tab on our website here. And here you can find items such as the patient guides, how to download or receive a hard copy, aortic terminology. We have resources for those in the community who have authored books of their stories, other stories, poetry, really great fun reading for you. And ultimately, we have some of our sponsors for this year, Edwards Life Sciences and Cook Medical. Thank you so much. You have sponsored this week's Week in Review, and you do so many things to help out the aortic disease community. And if you'd like to go onto our website and check out their links and read more about what Edwards Life Sciences and Cook Medical do for this community, check it out. It's invaluable, invaluable. They're invaluable. So that concludes our week in review. Actually, no, let's discuss some of the events we have. So on our events page, we have all the support groups, all the schedules for the support groups. We have caregivers, we have the Canadian group, we have Grupo de Apoyo, a Spanish-speaking group. We have so much here. Our calendar's chock-a-block full with support groups. So there's one for everyone here. Check out the times and the dates. And tonight, as a matter of fact, we have the WISE meeting, which is Women Inspiring Support and Empowerment. And that begins tonight at 7 p.m. Eastern Time. Click on the link and we will send you a notification when that meeting is about to begin. And tomorrow we have at 6:30 p.m. we have on AHTV here, Ask a Doctor. And we'll get that doctor's name here soon to you. But it's always great information. You could send in your questions and the doctor will answer them right there. And then tomorrow, Wednesday, the 28th, we have our last support group meeting for the month of January, and that starts at 7 p.m. Eastern Time. Thank you again for being here with me, and we look forward to seeing you next week.